We have a very special guest today, Dr. Teresa Cheng. She is an emergency and critical care specialist, and she was one of my mentors for many years. So grateful to have you.
Thanks for inviting me, Dr. Lopez.
One thing I've always wanted to know, what were your biggest saves, Dr. Cheng? Do you have like a couple of cases that whenever things get really rough and you're like, oh, we're never going to make it through this, that you kind of think of and you're like, well, that one made it?
Yeah. And I think, as you know, in our profession, you kind of have to hang on to those because you don't always win. So you kind of have to remember the days you do win to get you through the hard days, right? So
yeah. Like when you feel like hope is lost. What do you think of?
What do I think of? There are a number of memorable cases that span basically my career. So from my residency, for sure, my first case off the ventilator, it's super memorable. It was a hit by car. So it was a young dog. So we had our stars aligned. My first lepto case that needed peritoneal dialysis also as a resident. And he was in hospital for like 3 weeks. So you get super bonded as the primary caregiver for 3 weeks, right? You're always pulling for that little guy. And so, yeah, he made it. I remember his name, Ned. He was a little Jack Russell that would bite your face off unless he really knew you. So he would only let a few people touch him. So that was memorable. And in the end, I had the technicians make me this like huge sash that said, Ned Savior. And I was like, oh my gosh. It was made out of duct tape, right? So it was totally MacGyver, but it was very appreciated. And then Venus was another one. He jumped into a tub that was full of hot water. He's a little Daxi, so he like scalded his whole body entirely. And so he was in hospital also for like 4-6 weeks just for skin management. So he was there for a long time as well. Yeah, like infections, ear amputations, like his pinnas had to be resected, and that was memorable. But yeah, even recently for Canada West, like honestly for me, any case that makes it off the vent is entirely memorable just because they're already, you're just like, your odds
keeping
are so
them alive,
too.
basically.
Yeah, exactly.
Just hoping that their body
does it, right? Exactly. Yeah.
Other than neuro cases, I haven't witnessed that many respiratory cases actually get off.
Yeah, that's what I think makes it memorable for me, is that you're right. Even if you get them on, it's hard to get them off. So when they do make it off, you're just like, oh my gosh. It's a team effort, I will say, obviously, right? No one person can do it. It's an entire 24/7 endeavor that everyone has to be invested into.
Yeah, people don't realize that a patient on the vent requires a special room with a special team sitting there basically on watch every single second, every single millisecond.
Exactly.
To make sure that the patient stays alive. It's crazy.
Yeah.
It's been so inspiring to watch you guys and all of the amazing things that you do. It's just like mind-blowing.
Yeah.
Really.
It's a huge team effort. I applaud my team, of which, of course, instrumental part that you played as well.
Yeah, that was an amazing place to work for sure. About the scalding thing, actually, when I was a kid, my cat Frosty fell in a scalding bathtub. My mom had 5 kids and was like super busy all the time. And like the one time she ever went to like draw a hot bath, I like had just put all the kids to bed and then heard this like loud screaming. And I had a kitten that used to come and hang out with me on the edge of the bath when I was taking baths.
Oh, yep.
And fell in the bathtub and she got really badly burned.
Yeah.
And, like sloughing of the back legs. I mean, they got her out pretty quickly, but yeah, it was bad.
Yeah, it looks exactly.
Yeah, I mean, accidents happen, but I was kind of thinking back on my worst ones ever. And the thing that kind of struck me is that almost everything is preventable, right? So like you go through these major heroics trying to save these pets. And all of our worst cases, right? Like all that probably added up to like hundreds and hundreds of thousands of dollars that either like the owners or the insurance had to pay. But most people wouldn't be able to afford that if they didn't have insurance. And it's like, how can you save more pets? It's just preventing all of those situations from happening, especially with like the motor vehicle trauma one. We just live in a culture with this long history of keeping dogs off leash because that's how it's always been done. I think the more you work in emergency, you realize that they really need someone to hold their hand and, keep them safe and keep them from running into traffic.
Right. And as well as people can prevent, I still feel like it's, those accidents still define accidents, even in humans, right? It's the number one leading cause for young adults as well of death. So I feel, trauma, young adults,
young adults,
I think that for me, that's what kind of defines accidents. And even though you want to prevent it as much as you can sometimes, it just a slip of a leash or something, right? You just can't.
Yeah, or
right.
it slips, right? Or it breaks,
Right.
or
Yeah.
whatever
Right.
happens. The fence breaks, or
right. Yeah.
that's true. Well, in the last couple of years, I had a couple motor vehicle traumas that were pretty bad. They were like really close calls. You saw them. One got hit like 70 or 80K on the highway.
I'm sure.
Remember?
I think so. Yeah.
And
yeah.
then one got ran over with the front and the back wheel of the truck.
They did all right though, right? As I recall.
They both did fine. Yeah, it was crazy.
That's right. Yeah.
But I think the one I always think about where I like never want to give up on anybody was this cat in Taos that these kids found in a field, and they thought it was a dead skunk, and they realized it was actually still alive and it was actually a cat.
Right.
And it was literally the gnarliest thing I've ever seen. Like, it was so disgusting.
Oh no.
A really young cat, like really young, had been giving birth in a field and had dystocia.
Oh,
and
no.
literally had just been left there for many days, and you could tell.
Yeah.
Honestly, they don't teach about maggots in vet school. I never like had a maggot chapter.
I think that's because you would quit if you did. So,
but that's one thing I realized when I was working in Taos. I was like, nobody talked about maggots, and like this is like I'm seeing a lot of this.
Right.
But like just by the size, like she'd been there for many days. I opened her abdomen; it's just like rotten garbage.
Oh.
Literally, everybody in the clinic was like throwing up, opening all the windows, and so I was basically just doing an emergency OHE and septic abdomen, and like it was just like so disgusting, like
oh yeah,
like rotten abdomen. And so we're just like irrigating, and I'm just like, does it still smell bad in there? And Joel, who was doing the anesthesia, he's like, I don't think anybody would ever be able to answer that. Like, it smells so bad in here.
Yeah.
And I was just like, okay, well, I think that's enough. And then I was closing, and she actually died under anesthesia.
Oh no!
And I was like, no. So we started just doing CPR, and then it went on and on and on and on. Pretty much like a half hour later, it had just become like an exercise, you know?
Yeah.
And then like all of a sudden, the pulse ox, which was like only beeping when we were doing compressions, it all of a sudden just came alive. We didn't have a capnograph there.
Right. Okay.
So it just like came alive, and I was like, oh my God, like her heart is beating again. Over the next several months, it was pretty much starting from the bottom, just even getting her extubated. And this was just like in a little clinic. We didn't have support or anything, but she eventually learned how to like swallow and walk again.
That's incredible.
And she was like really blind.
Yeah.
Would kind of go in circles and stuff.
Right.
But she regained everything, and then eventually was like normal. Whenever I'm doing CPR, I always remember that case. I'm just like,
that's an incredible case.
That was full 30 minutes in, and she came back and made a full recovery.
And who has her now? Is she... Because she was destroyed, I presume.
Yeah. And it's actually crazy that my boss even let me... He wasn't even there that day, so that's why. I'm pretty sure he wasn't there that day, so that's why I got away with it. Because, like, who's going to let you pour that kind of resources into a homeless cat, right?
Right.
Nobody with an actual management would ever be able to do something like that, you know?
Yeah.
But yeah, his friend was a really amazing artist, and she had some other cats, like some amputee cats, in like a little courtyard, and she was home a lot doing art, so we adopted her out to her. And yeah, she sent me some photos. There was a photo where she had actually caught a butterfly, which was so amazing for this cat that literally had gone from being totally disabled. Dead. Yeah, but so she ended up having like the best little life, and it was so cute. But she was black and white, and where we shaved the abdomen, you hear like these weird stories about this stuff, but this one was true. Where we shaved the abdomen, she was black and white. Wherever it was black, it actually grew back really light gray.
Oh, yeah, that's weird.
Isn't that crazy?
Yeah.
But anyway, we got to ask you this one. What's your best advice for pet owners?
Oh, there's so many. I guess. Yeah, I would say very similar to any big purchase. I look at a pet as being a big purchase, a big addition to the family. So even starting with research in terms of what is your situation and what breed suits that situation is probably the first thing. And then once that's known, then to look at the breeds and to know what their medical issues are and what they're predisposed to, and see if you're okay with that. So you're at least informed and aware of what to be looking out for them as they develop. And then finally, I think for almost all my client subs that I would say, once you're at that step of getting that pet, then get insurance. Like day one, get insurance, because it certainly can make or break a case. And we've seen that all the time with the cases that we deal with.
Yeah, a septic abdomen, right? If they swallow a toy and it ends up perforating.
Yeah.
Have the surgery and hospiitalization to take care of those if they're
absolutely
moderately bad.
Yeah.
in
Yep.
Canada, those are what, like close to $10,000.
Oh, easy. Yeah.
For.
Yeah, it depends on how sick they are, but we're quoting in excess, like upwards of 10,000. And so and we do have a few clients subset that, dropping that kind of money doesn't really matter for them. And that's great. But I think for
the 1%,
the 1%, exactly, for the vast majority of the clients we deal with, that's not possible. It's not possible for me. Like I wouldn't be able to do that. So
no,
I have insurance on my pets, right? And so definitely pet insurance is super helpful. Personalities are so different. So I love the fact that there are so many different pet personalities, dogs, cats, little pets, birds. So I don't really have a particular advice for, what's the best breed or what's the best animal. I don't really have that because I think it's all driven by personality. All of my pets that I've had, they've come from the SPCA or like a rescue or something like that. So like pets that need homes, I would advocate for. But other than that, I don't have a problem with really loving a particular breed and doing your research, doing your due diligence, getting a really good breeder and getting that breed, right? I think there are many fine attributes of the breeds of dogs that are out there or cats that are out there.
Cool.